Thank you for joining me at Dr. Nasar Shahid's forum for how to prevent chronicity in pain management, chronic pain, how to prevent chronic diseases, and how to achieve well-being. We have done series on neck pain. The last but not the least is the surgical intervention. So we did non-pharmacological interventions. We maximized our lifestyle modifications to be closer to the nature. We looked at our ergonomically fixed workstations. We looked at our habits. We tried our sleep patterns, and we also looked how we are eating. So all these things we maximize, but still we are left with pain. Even though we have done the injections, still the pain keeps on coming back. And every time it comes back with little less severity or more severity, but enough to interfere with our functions. Now what to do? Well, as far as the pain is concerned, I can assure you that no matter how severe is the pain, the injections mixed with pharmacological and non-pharmacological interventions and some lifestyle modifications, 99% pain gets better. 0.1% or 0.01% people who need surgery because of pain only pain. I mean, the other tests, the neurological phenomena is fine. There is clear pathology of cervical spine, disc or joints. That's where you have to be referred to the surgeon. But you should know, are you going to the surgeon only because of the pain? If it is the pain only, then you have to go through the whole process. But sometimes you don't have to go through the whole process, and the first thing has to be done with you is to send you to the surgeon. Why? That's when the central nervous system is at jeopardy, is danger to the central nervous system. And how we know? There is a weakening of the muscles. There is something going on in the neck which brings the red flags. There is a balance problem because there is a mechanical pressure over the spinal cord. In those cases, we don't wait to do these all actions and then send to the surgeon. We right away send this person to the surgeon. No, mainly the surgeons are either going to decompress something, makes more room because of the disc herniation, because of the hypertrophy of the joints or bony part, or sometimes they replace the disc, and sometimes they do minimally invasive procedures. That is the choice of the surgeon, how they do it. Sometimes they find there is stability issue in the cervical spine, one vertebra over the other vertebra, or there is a potential instability that the vertebra can get into the spinal cord and the person can be paralyzed. In that case, they fuse 1 or 2 levels so that the person can have a stable spine. So all these workout and all these decisions are made by the surgeon. But you should know why you are getting the surgery. Is it only pain, or is it because there is a danger of neurological paralysis or problem? When you combine these things, then you can give an informed consent for that surgery.